time for 10 minutes to your health, and this morning we're discussing the molecular evolution. Dr. Melissa Lee is with us. She's a doctor in molecular microbiology, also a medical doctor. Good morning.
Morning.
Welcome to Smile Jamaica.
Thank you.
Melissa, you sound bright.
Well,
yes.
I would hope that I am.
Just to pronounce the word there for bright.
Yes.
Tell me about molecular microbiology. What's that?
All right, so we simplify molecular biology. I'm a microbiologist, so I just say molecular microbiology. So molecular biology is basically when you use molecule or the DNA, RNA to identify what's going on in the body. So traditionally, labs usually look for the organism, so you try to grow it in the lab, or you look for a protein, or you look for an antigen or antibody in your body. What the molecules do, we actually go to the cell, because the cell will have the DNA and the RNA that gives the instruction as to what to do. Mm-hmm. So all cells, you have cells all over your body. So all cells will have their genetic code, and going to the molecule actually go to the direct problem, which is why molecular evolution is basically a more advanced way of diagnostics. And that's why we're actually promoting molecular evolution.
All right, so why would I need to access this type of diagnostic service? What difference would it make than me doing something else?
So when the pandemic came, you realize that it was basically a crash because we didn't know how to identify what's going on. Initially, they used electron microscope to figure out that, hey, we something new. Mm-hmm. But what they had to do to confirm that it was something new was molecular diagnostics. You really can't tell if something new unless you really try to get the genetic information from a pathogen or whatever, because everything have their own unique identity, just like you have fingerprint, right? Mm-hmm. So the molecular information gives us the specific information that we want. So as it relates to disease processes, you have mutations that are specific to certain diseases. And I mean, the science...
Is that why, like, when COVID-19, they can say this is the Omicron variant?
Exactly. So molecular detection will help you to see if you have a new variant, if you have a new gene, if you have a new pathogen. So if we can master molecular diagnostics in Jamaica, if we have a new pandemic, we wouldn't be scrambling all over the place, right? If you have somebody that is sick and it's a difficult diagnosis, you can use molecular diagnostics to help you to identify something unique that is, specific to one person.
Yeah, you've used the word new about 10 times already. Is molecular diagnostics new?
It is not new, but it's an emerging field. So I guess you would say that it is new. Yeah. So I think the science actually promotes more molecular diagnostics all over the world because it's accurate. It's basically like as I said, fingerprinting. There's no way you can go wrong with molecular diagnostics.
I'm listening to you, Melissa, and I'm thinking, how did we manage to set up or continue to set up a lab here? Because oftentimes I will hear about advances in technology as far as medicine is concerned, but the price tag's so big. There was a time when we had to send samples away to be tested to confirm that it was chick-V or that it was, because there was one lab.
We're still doing that.
Okay.
So the problem is we've tried to implement molecular diagnostics before. There are probably just one lab, I think, that does genetics, more like paternity. But, in terms of the clinical side of things, we're not covering anything as it relates to disease processes, chronic illnesses, new infection, or even the long list of infections or pathogens that are already exist that we've never seen before. And that's where Molecular Evolution Lab comes in, because we're doing so many new diagnostic testing. We're seeing new pathogens in Jamaica before. For example, I actually mentioned Mycoplasma hominis that we're identifying now as a causative agent of sexually transmitted infection for the first time in Jamaica. It's causing asymptomatic as well as symptomatic STIs. If we weren't testing for Mycoplasma hominis, we wouldn't know that we're having, I would say, a silent epidemic, if you want to call it like that. So, and Mycoplasma hominis is just one. We're doing gene mutation for various cancers, and we're actually seeing JAK mutation for the first time in patients with blood cancers, for what we call a polycythemia vera, patients with thrombocytosis when the platelets are high and they're predisposed to clots, they're having underlying gene mutation that is causing these things. So you have a complicated patient like that, you send them all over the place. There's nowhere that can tell them that this is what is happening to you.
It's interesting because I've said it many times on this program that I've learned so much, especially in this segment. And when I was preparing for this, because I didn't know about all of this, and I read without molecular, and I'm reading now, expertise, detection and diagnosis, which you said for COVID-19 would not be possible.
No.
So how come I first may I hear about it?
Well, when the pandemic came, I was in microbiology at the hospital, and we got machines from wherever. There was nobody to really set up, optimize, and troubleshoot. You really needed the expertise, and even after establishing your troubleshoot protocols, you're going to run into so many errors. It took me years to actually. So
it's a new area. It's a new area, isn't it?
Exactly, it's a new area. I was given the great opportunity when I did my PhD in Europe, the Medical University of Austria, in Vienna. That was amazing because I got to just explore and experiment. So they had all these new technologies, for molecular detection and sequencing, and they welcome you with open arms, especially when you're young, because I was in my 20s doing my PhD there. And I was just like in the lab 2, 3 a.m., 4 a.m.
Doing a candy store.
It was basically like that for me. So it was so exciting. And after my PhD, I was just like, no, I have to bring all of these things to Jamaica because not only can it generate a lot of money, but if we can map the whole genetic database of our Jamaican people, I think this is a great source of empowerment, and also it will assist us to take better care of ourselves.
Absolutely, absolutely. Particularly some of those non-communicable issues that are so prevalent here. You might be able to give us a handle on why it is so prevalent here. You have the Charitable Foundation Meds Fund has been assisting you with this drive?
So, I started Meds Foundation when I was a med student because I love Jamaica. I've gone through different health institutions, and when you see the conditions that people have to go through, you really have to sympathize, empathize. So I started Meds Foundation in response to what the need. So we donated like wheelchairs, ventilator circuits, stuff like that to VJH, KPH, and it's been a really good journey. Meds Fund literally just transitioned into Molecular Evolution Laboratory because I thought that was a bit more, I would say a sophisticated way of contributing. If you can add knowledge that can benefit people, I find that is more fulfilling because when somebody can come back to you and just say thank you, and they know that you told them something that nobody else in Jamaica could tell them, they literally stick with you for life. And that's
apart from what we're doing now, how would someone know about all of this that we're talking about? Because I didn't know. And who comes to you? Who should come to you?
All patients. So molecular evolution, the important thing about Molecular Evolution Laboratory, it's not only a molecular lab. We incorporate all the other laboratory testing options. So the chemistry, the hematology, the pathology, the microbiology. So if you come, you get a comprehensive package. So we can give you...
But come to you with what is what I want. So
if it is that you need a lab test done, if it is that you have a difficult diagnosis, and our prices are also very affordable for molecular. And why it is important, I have the ability to actually make the kits. So companies, even abroad, would actually have to buy the kit. If we can make the kit, it means that we can get it for 10 times cheaper, which is why my price listing is so cheap, because I actually got the opportunity to learn how to even assemble the kits with the to assemble.
So you're a double doctor.
Yes.
You're a medical doctor and a PhD. All right, so she's a double doctor. Good to see you. Congrats.
Thank you.
Congrats on what you have done thus far, and I thank you for your service.
Thank you.
Dr. Melissa Lee, Molecular microbiologist. 10 minutes to your health, folks. We'll do it again next Thursday. Too early for go through them words.
Oh my God.
I need a doctor to tell me about them words. So come.